We've heard two major announcements from Renown Health recently. Hi, I'm Kylie Rowe, the Vice President of Relocation at Dickson Realty. Today we have here with you Wendy Damonte, the Vice President of Advocacy and Community Partnerships. She's here to give us the scoop on what's been going on at Renown Health. Wendy, thank you so much for joining us.
Thank you for having me. This is great.
Yeah, this is fantastic. So tell me, what do people need to understand about Renown Health?
Well, Renown Health is so much more than just a hospital. We have this big, beautiful building near downtown Reno, but we are a health system that's comprised of 3 different hospitals. Okay. We have our own health insurance company called Hometown Health. We have hundreds of physicians that work for us and with us, and we're really out in the community, contributing, making sure our people are taken care of when they need us, but we're also kind of changing our focus too to making sure that people try and stay healthy, and we're implementing programs to make that happen.
That's fantastic. And so I alluded earlier to these 2 big announcements you've had. One of them is a partnership with Stanford University. Yes. Tell me a little bit about that.
That one is really, really exciting. So we can take care of you. The first and foremost thing that people should know is we can take care of you almost in every single case. In the times when we can't, such as severe burn, or if you need a transplant, you can come into our building, meet with your hometown health doctor, and if you need to go to Stanford, you transfer automatically. We take all the guesswork out of it. We're even working right now on transportation contracts. I mean, we are looking at every single detail to make sure that we take care of you here in Reno, but if we do not offer that service because it's simply there aren't enough people in town to provide that service, such as transplants, you're gonna go to Stanford.
Wait, that sounds easy.
Yep, it is easy, because when you're in that moment as a family, if your child is in that moment, you don't want to make serious decisions about where should I go, how do I get there, how do I pay for this, what am I going to do? We take care of it for you and send you right over the hill for the most severe of instances in healthcare.
That's wonderful. And there's another huge initiative that has been all over, I know, my social media, the partnership that Renown Health has with Desert Research Institute, powered by 23andMe. So tell us a little bit about that so people can hear it from you.
Yeah, first of all, it made national news,
international,
it's huge, global news. They were covering us in India.
Wow.
Right, so it is a population health study, and what we're now doing, and it's the first time this has ever been done, is we're combining medical data, medical records for the past 10 years. We're combining that, so that's our first layer. Then we're layering on top of that environmental data from DRI. And now with the collaboration with 23andMe, we now have genetic data. So when you squish all that together, peaks are going to form, right? So it might be a peak of, let's say, atrial fibrillation, a common heart problem a lot of people have. Now we can look at the environmental data. What was going on when we had a bunch of admits into the ER for atrial fib? Oh, look, the air quality was at this level. So now if you have a genetic precursor to get atrial fib, we can try and help prevent it from happening in the first place with different programming. Or if you already have that particular condition, we can contact the local media and say, hey, if our air quality gets to this level, we know people with atrial fib are more likely to end up in our ER. Put out an announcement and say, if you have atrial fib, you might want to stay inside today.
Well, that is so amazing. And, you know, I think in my experience, public-private partnerships tend to be some of the most effective programs in communities. And I understand Renown Health is a nonprofit.
That's
so
right.
What does that mean for our community and how you're working with other people?
It's huge. Kylie, it's really who we are as an entity. So because we're nonprofit, that means we don't have a big wealthy owner somewhere that all of our resources go to.
Right.
It means we are governed by a board of local citizens. And it also means that we contribute back into the community. Anything that we make, it goes back into better technology at our different hospitals. It goes into making our infrastructure better so that people get more and better treatment here. It also means that we give back almost $2 million.
That's amazing.
In donations to different organizations around town that are working on getting people healthier and making this place such a great place to live.
Well, that's really exciting, Wendy. Thank you so much for coming.
You.
We're so happy to have Renown Health in our community, making this a healthier community to live in.